All right, we're going to go ahead and get started. So thank you all again for joining us today. For those of you who are unfamiliar with me, my name is Christopher Jammer. I am one of the regional account managers for Airrosti Rehab Centers here in our Austin region. And today we have with us Dr. Constantine Dino Pappas and Chris Norris. As in there in one of our north far west office off of MoPac. So just some housekeeping things before we get into the actual presentation. As you all saw, whenever you were admitted into the presentation, your microphones were muted. That's to make sure that we can get you all the information as quickly as possible and as efficiently as possible. And also, for everyone that's on the call, I'll have you send me your first and last name in the chat so that we can get you recorded for your wellness points through Austin AISD. You can send that throughout the presentation at any time. I just need to make sure that I get that from you guys. Also, we're going to be getting you the presentation as quickly and as efficiently as possible. But if you guys have any general questions that you would like to ask either myself, Dr. Pappas, or Chris, you can send those over in the chat function. But also you'll notice at the top right-hand corner of different ones of the slides, you'll have the QR code that leads you to our virtual injury and pain chat. So if you have a very specific question that you would like to ask and you don't want to ask it on a virtual platform just for HIPAA reasons, you can scan that chat code and get yourself admitted into one of those actual VIP chats. So I'm going to turn it over to Dr. Pappas to take us through what we call our Foundations of Fitness presentation.
Thanks, Chris. Appreciate it. Looking forward to sharing some information here and looking forward to answering everybody's questions afterwards. If you have it, please feel free to let me know if it's something confidential. That's why we have that VIP chat where you can you reach out to me after the presentation. I think my email and contact information will be on the back portion of the slide. So there's a couple items that we're going to go over. One of them is the concept of the joint by joint approach. Some parts of your body need motion, mobility. Some parts of your body need strength or stability. That's in essence the joint by joint approach. We're going to help differentiate out pain versus non-painful movement and what the value and importance is of recognizing that. Going to go over some simple exercise fundamentals, and we're going to go over a couple specific things in the office, movements that we screen for and we utilize as well. And then Chris will wrap it up on the back end. That's the agenda for this presentation. So what is the joint by joint approach? Some portions of your body, they need motion, mobility. Some parts of your body need stability. And the body works as a series of levers where some parts need to move and some parts need to be stabilized. All motions and movements should be pain-free in the body, and when they are not, it requires you to modify your exercises that you're doing at home, or a dedicated professional like us at Airrosti, primary care physician, or the appropriate specialist. For example, if you look at the screen and you look at the shoulder is highlighted in red. That is the shoulder is inherently an area of the body that has quite a bit of motion and movement. It actually has one of the more joints that has the most movement of any joint in the body. So if it has too much motion, oftentimes it needs to be stabilized. That's why you see it in red. It's inherently mobile. It needs to be stabilized. Likewise, there are areas that are inherent stable that need motion. The hip joint, if we look at the model here on the screen, we see that blue right around the hip. That's an area that has great amount of stability and not a great amount of mobility. So we need to work on strategies that mobilize the hips. And again, this series of building blocks, the body, series of levers, we alternate between motion and stable, and that's what we do at Airrosti. We find out the areas that need mobility, given mobility, the areas that need stability, let's stabilize them. So one of the movements that we figure is essential, it's essential for a couple reasons, is the forearm plank. And I'm going to describe that here, and then I'm going to use my model, Vanna White back there, AKA Chris Norris, to go ahead and go through a plank. So if we look at the screen here, we see a lady resting on her elbows. As she rests on her elbows, she's providing shoulder stability. The shoulder muscles around the back here of the shoulder are contracting to lock the socket, the ball, into the socket and provide stability. We also see she is level all the way across her torso. That means her core muscles, these muscles right here, they're starting to engage to support her trunk. Inherently, the low back and other areas of the body are less likely to be stable. So this is getting core contraction to provide stability here, abdominals for her low back. We also start to see in this position here, the muscles of the neck trying to support the head and torso in that position. So we're getting stability of the neck, the torso, and the shoulder. Let's have our model Chris demonstrate a forward plank. See if I can tilt this camera down here. So we start to see our model here, Chris, right here. So when he's in this position, we start to look at the elbow. The elbow is driving contraction of these shoulder muscles, and I feel these muscles tensing up here to provide shoulder stability. We notice Chris is not arched up, tented up. We notice that he's not dropped down into this position. We want him in a neutral position. Now his core muscles on the side and important are his abdomen are firing. Chris is also supporting his hips. He's getting gluteal contraction of his glutes right through there as well. So this is a really good exercise and a really good test. You go ahead and relax. Even though it'd be nice to have Chris hold that position for about 16 minutes, that would be cruel and unusual punishment. So about 30 seconds is what we recommend to use that as an exercise. Hold times 30 to 60 seconds. Again, good exercise. Stability of the shoulder, stability of the torso. All right, let's go to the next slide. Side plank, we look at the lady on top of the screen. Again, that shoulder and that elbow pushing into the ground, that drives the ball into the socket. The muscles of the shoulder blade have to fire. So we're gonna get stability of the shoulder. We look at the model here on the screen. She is level. We can draw a line between the shoulder and the hip, and there's no curvature of the line. That means she's getting stability of the side muscles, including quadratus lumborum, obliques. And we continue this and we look at that angle between her feet and she is stable on the side. So this is a good exercise for stability of the torso, but all the way up in reality from the shoulder all the way to the feet, we're getting stability along that line. Let's have Chris practice that. Cool, let's tilt that sucker down here and rotate that camera here. Let's look at Chris here. As Chris is putting his elbow into the ground, it's actually pushing and locking that shoulder into place. When he locks that shoulder into place, he's getting contraction in the shoulder blade muscles. The lateral muscles of his torso, latissimus, QL, and glutes and obliques have to keep him on up. And go ahead and go on down, Chris. And that's an exercise that we're looking for from a stability standpoint. Now you may say to yourself, this is a good test, but also an exercise. Can I make this easier? I can't do that. It's not in my capabilities right now. Yeah, here's the modification. Let's have him go on his knees up. Let's have him go into this position here. And now this test also becomes a modified exercise. Shorter lever arm, he's not on his feet, he's on his knees, less that the body has to hold on up. And again, he's getting stability all across this area here. Hey, Dr. Pappas, I can't do that one. That's still too difficult. We can put somebody on the wall. Go ahead, Chris. Let's flip this camera around here. Let's put you on the wall. Right about there. And then go into the wall. And then push your body out right. Good. And same thing. We're getting stability here. Drop your arm down just a little bit so it's level with your torso. Perfect. Stability of the shoulder, stability of the side right through here. So we can turn this into different variations to make it as complicated or as easy to get to your level of fitness. This is regressed and progressed right through there. And it would be fun to have Chris hold that for about 16 minutes, but we don't want to make him sweat too much before dinner. All right, next slide, please. All right, what about the push-up, Dr. Pappas? Push-up, upper body strengthening exercise. We're getting strengthening of a couple specific areas. We look at our model on the screen. She's getting wrist work. The wrist is being pushed in the ground, shoulder work and triceps work, but also she's getting core stability. The torso has to stabilize her when she's away from that position. You look at the top of a push-up position, it's just a plank, but instead of being on your elbows, you're going to be on your hands. Your abdomen has to stabilize you. So motion of the shoulders, torso control is what we're getting here with the push-up. All right, Chris. Do it from the wrist here. Start from the forearm. Okay. And from this position, we look at Chris, have him go down and then push himself up. Good. One more time. And as we're having, you can go ahead and come on up, go ahead and relax. And as we have Chris go into this position here, what we're trying to prevent from this situation is him arching his back at the top in that position, or him sagging down too far in the bottom or tenting up. That's the torso working. The shoulders are moving, especially the shoulder blade as you push forward. And then as you come back, you're getting the shoulder to move forward, slide forward, and the shoulder blade to slide back. And that's a good general upper extremity and torso exercise. I will know if you have wrist pain. Now, Chris actually does have wrist pain currently. He went from this position here to a fist position where the hands are pointed together. This will reduce the impact to your wrist. So if you're one of those people, you do exercises on your hands, you start to get wrist pain. The trick is to get your wrist in a neutral position. This is extended, pushed back. This is neutral right here, and use your fists to push in that position. That can help patients out with wrist pain. That's the modification we made for Chris because he actually does have wrist pain. All right, next slide, please. So an overhead press. Let's have Chris grab the dowel rod. All right, let's look at the model on the screen. Model on the screen will start with the bar around chest level. She has her hands facing away from her torso. She's going to push that as Chris will be pushing that upright. Go ahead and push that towards the ceiling. Cool. Let's take a look at this here. As Chris pushes it up towards the ceiling, the abdomen and the core have to provide stability to arch this guy down. I do feel good core engagement. Chris also has to have motion, mobility of his upper shoulders and scapula to lift that in the overhead position. Go ahead and bring that guy down. What we don't want to see, get in the side view, Chris, is people arch. Let's do it the wrong way. Some folks will start to arch their back, and when they'll arch their back, they'll create some increased chance for back pain right through here. Bring it back down. When we push up and slightly forward towards the ceiling. Go ahead and push up slightly forward towards the ceiling. Now transfer your weight back like this, right? And when they transfer their weight back like this, arch, that's where the problem lies. But if the bar is transferred slightly forward, they'll keep in a neutral position, and that will help their back on out. So this is a good assessment looking for overhead mobility. And also, do you have torso control so you stay vertical rather than cheating and arching backwards? So shoulder motion, overhead strengthening, and also looking at control of the abdomen over the torso. Now, what about a lunge, Dr. Pappas? That's a very functional movement. When we choose to pick up something from the ground, we have a couple choices. We can choose a lunge or we can choose a squat. The lunge is advantageous for folks that have some issues and problems with balance and stability, because when you go to a stance where one leg is in front of the other like this, one leg in front of the other, it provides you an opportunity for an unstable situation where you can work on your balance. But if your balance is too bad, and hey doc, I'm gonna fall over because my balance has issues, you can go with a two-legged stance or the full and legitimate squat position. Squat, lunge works more on balance. Squat is more if you need stability. It's a quick way to get to the ground. So let's assess Chris here with a lunge. Now let's have him go into that position right about there. From that position, look at the position of Chris's knee. His knee is not significantly over his toes. When the knee comes significantly over his toes, it creates a little bit more stress on the knee. So ideally, the tibia, that shin, is vertical or somewhat vertical. Let's take a look at Chris's torso here. I'm going to change the camera angle ever so slightly. Chris's torso is erect and vertical. He's not swayed back, forward, or backward. That will create undue pressure on his spine here. So we're getting mobility of the hip. We're looking at mobility of the ankle. As the toes rise up, heel rises up, typically indicates they're a little stiff on the ankle. Chris has good motion of his ankle because his shin remained in a vertical position. His heel did not come on up. His torso is vertical, so his abdomen is controlling him here. Chris, let's give you a forward view. Let's come towards the camera. Cool. Now we get another view. Again, we're getting motion of the hip with the lunge. We're getting movement of the knee, or we're looking at ankle motion. But we're also looking to see if the knee caves inward. Some folks who have this situation, this will put a lot of stress on the ligaments of the knee. We can only assess this from the front. It's hard to assess from the side. Good news is Chris's knee is in a good position. It's not turned in, it's not turned out. Again, it would stress the knee. So lunge is a good general screen of motion, mobility, also torso stability, and the ability to control the knee from coming in and coming on out. It's a good exercise. It's also a really good assessment. Go to that next slide if we can. What about the squat, Dr. Pappas? Yeah, I mentioned it a little bit ago. The two ways of getting down to the ground are lunge or the squat. Squat is a good assessment. It's also a really good exercise. It's very functional because we have to do it to get on and off a toilet seat every single day, right? So we look at our model on the screen. What are we checking for? We're checking for if she can sit her butt backwards. Again, picture a toilet seat behind you. You need to sit back on it. Second, is her torso erect and vertical? Is she rounded forward way too much? Is she hyperextended too much? Or is her torso in a good position? Third thing, we're looking at mobility. Mobility of the hip to sit back, mobility of the ankle. Is her heel rising up? And the answer to the question, his heel is not rising up. She's able to sit back nice and functional. Let's use our model Chris here. Side view is great. Thanks, Chris. All right, let's take a look here. I'm going to drop this down just a little bit more. We see Chris able to sit back right here into the hip. We see his torso fairly vertical here. He is not overly rounded forward like this. He is not extensively arched. That will create some back pain in Chris. Come on up, Chris. Maybe sit down again. Let's take a look a little bit lower. All right, notice that Chris's heel stays on the ground. The knee is fairly over the toe. He is not too far rocked forward, so this is a good distribution of weight. So we're getting motion of the hip, motion of the ankle, control over the torso. So the squat, good exercise, good assessment as well, looking at general motion of the lower body and abdominal control. All right, so we've gone over a couple simple screens, a couple things that you can utilize for your home program, and a couple good assessments. At Airrosti, we use these assessments in office. I use in particular the squat and the lunge. I'll also use an overhead press or an overhead reach. Kind of let me know what's going on and how we can make you better as well. So I want to thank everybody for the time. I want to thank our model here. I did make him sweat, unfortunately, but thank you, everybody. And let's turn this back over to Chris Jammer.
All right, guys. Thank you, Dr. Pappas and Chris, for explaining those different exercises that you can go through from a general kind of fitness standpoint. And I'll talk a little bit more about Airrosti, kind of what we do. For most of you guys, this will be a big review, but for those who are brand new, just in general, the screens, the numbers that you see on the screen are basically what we do to make us who we are. So at Airrosti, we work specifically with what we call soft tissue injuries, making sure that we get you better really, really quickly and as efficiently as possible, is getting you back to the things that you love to do. So on average, we only see our patients about 3 to 4 times to get you to total pain resolution. As you can see, I won't go over every single one of the numbers, but a lot of our patients utilize this almost like a second opinion if they've been to traditional chiropractic, if they've been in traditional physical therapy, or if they're looking for more of a longer lasting effect rather than a short-term relief. So today specifically, Dr. Pappas talked about some general exercises that he uses almost as screens. So on the screen, you see different conditions that we treat. So a lot of those things that he took you through, he will go through in a range of motion test to see what's going on specifically, like with your squat, if you have any knee pain, if you have any sciatic-like pain, or specifically with like the push-ups or the planks, if you're having kind of upper back, upper shoulder pain, those are the things that he will take you guys through. So, and lastly, all Airrosti visits for Austin AISD Aetna Health Plan members are in network for all of the plan members and the benefits. You don't need a referral to go see us, and all of our locations are currently still open. Dr. Pappas's location is off of Northwest Hills location off of Austin Center Boulevard. And if, of course, you have any questions that you would like to ask us individually, you can utilize those VIP chats in the QR code that's in the top right-hand corner of the screen. Or if you have any general questions that you would like for Dr. Pappas or myself to answer, definitely shoot those over to us in the chat function. But if not, I'll give you guys some of your time back. Thank you all for joining us again, and we hope that we see you the next time.